Good afternoon, everyone. It's good to be back with you today on Monday, August the 31st. Tomorrow will be the first day of September. And I know we are all glad that August is behind us. This weekend, it was a somber privilege for me to spend much of the weekend on the Mississippi Gulf Coast. As many of you know, it was the 15th anniversary of Hurricane Katrina. We had the occasion to make stops in Biloxi and Pass Christian and Gulfport, as well as in Waveland in Hancock County at the Katrina Museum. And we remembered the horror of August 29, 2005, and we memorialized everyone we lost. But we were also able to celebrate the resilience of our state. We know that we have bounced back from that tragedy, and we've even come back stronger than we were before. It was a powerful reminder to me because I know we'll do the same after this COVID crisis. Earlier today, I signed an order to extend our previous mitigation efforts with one change. We are increasing the number of spectators at school sports and other extracurricular events to 25% when social distancing can occur. Obviously, we've talked about this before. We signed the previous order a few weeks ago, and it's working. Things have been improving. We can always improve faster. We can always do better, but I'm encouraged by the efforts of the people of this great state. As our numbers improve, we're able to do more and more safely in the community. I want to thank the people of Mississippi for working hard to make these improvements possible. Nothing is without risk, but we have to allow life to go on and to deal with these challenges that are before us. You'll recall that several weeks ago we had reached 9,200 cases over a 7-day period. That's Saturday until Friday. This week, that number was right at 5,000 cases. So we've cut our weekly numbers in half. Now we need to cut them in half again. We know that Labor Day is upon us. We know that with both Memorial Day and July 4th, large gatherings occurred, and in many instances, there was transmission that led to increased cases. That is one reason that we have decided to extend the order that I put in place weeks ago for 2 more weeks. My ask of you is this: as we move into Labor Day weekend, please continue to make the effort. I've said it 100 times before, and I'm sure I'll say it 100 times again. But in this crisis, none of us has been perfect, including myself. But if we keep trying, if we keep working together, if we keep doing the little things, we will see things continue to improve. We will protect each other, and we will create an environment that is more like normal than what we've been dealing with for much of 2020. With that, I'm going to ask Dr. Byers, who is here in place of Dr. Dobbs today, to give us an update on the numbers. We obviously had a very good day today, following up very good days the latter part of last week, but we must continue to work hard. Dr. Byers?
Thank you, Governor. So today, we're reporting out an additional 274 cases and an additional 32 deaths. 19 of those deaths come from vital records reviews or death certificate reviews, and those deaths occurred between July 8th and August 24th. We continue to review death certificates and vital records data to identify deaths that weren't reported through the normal processes. So that puts us at about 83,000 cases total statewide and about 2,500 deaths. And Of those deaths that we've reported out today, 12 of those are among long-term care residents. But if you've been watching the data, you have seen that we've seen some minimal decreases in the number of outbreaks in long-term care settings. That's encouraging, and we want to continue to protect that vulnerable population. The 274 cases that we're reporting out is encouraging. Y'all know that from watching the data, often we see some decreases over the weekend from the numbers that we report. So if you look at our trends and our trend data that's on our website, you can see that we have been trending down. It looks like it's starting to level off a bit now, and maybe even go up a little bit, but it's not as dramatic as the increases that we saw, especially after the 4th of July. And we certainly hope that we don't see a similar picture after Labor Day. Hospitalizations, we've seen some slight increases in the number of people hospitalized with confirmed COVID. We've seen some minimal increases in the number of folks on ventilators due to COVID. We'll continue to watch that data. One of the things that we're doing is continuing to work with the schools, and I've told y'all before that I've been real encouraged from what we've seen with the schools so far. By and large, the schools that we've been working with are really working hard to identify cases within the school setting and to get those individuals quarantined or excluded from school, and to get those cases isolated and excluded from school. This is preliminary report, and you know that we're going to be reporting aggregate data on a weekly basis by county for our schools. But for the week of August 24th through August 28th, there were an additional 123 cases among teachers and staff, an additional 251 cases among students, and with that, in last week's time frame, we were looking at about 3,500, a little bit over 3,400 students that were quarantined, and about 450 teachers that were under quarantine as a result of their exposures. Again, this data is preliminary, and we're going to be reporting that out on our website probably tomorrow as we continue to get these reports in from schools. Dr. Dobbs and I last week had an opportunity to visit with a couple of the larger universities in the state to go over their planning and to look at their processes that they have in place. Many of our universities and colleges have been pretty transparent about the numbers of cases that are occurring on the campus setting. And, you know, we've been working with the colleges and universities now for several weeks in their planning process and have provided them some guidelines. I was pretty encouraged with what we saw in the college setting with their overall plans to identify cases, their overall plans to identify those individuals who are exposed, make sure that they have areas where they can get them quarantined, make sure that they have areas where they can get the individuals isolated. By and large, they've done a pretty good setup in their classroom setting too to limit exposures. And I tell you, I'm real pleased with the work and the collaboration that we've had both with the K through 12 schools and with the colleges and universities, and we hope to continue that good relationship. That's my report, Governor. Thank you.
Thank you, sir. Let me just say this. The next 10 days are critical. If you look at our 7-day rolling average in total number of cases, we are about where we were just before July 4th. That was 2 months ago. We were in the range of 700 cases per day on average. As we saw in middle to late July, partially because of July 4th, but not entirely, what we saw was a pretty significant uptick in cases in the latter part throughout the month of July, which led to significant hospitalizations, which led to significant stress on our healthcare space. And it, quite frankly, led Dr. Byers and Dr. Dobbs and I to have some really difficult conversations as we tried to deal with the lack of ICU capacity and lack of other capacities within our healthcare system. Fortunately, the people of Mississippi responded. Now, at that time, going into July 4th, we were trending up, but we're about where we were. Now we're trending down, but are back, in terms of total numbers, back down to that approximately July 1 numbers. So the next 10 days are critical. The next 10 days are critical because we have an opportunity to really shoot the numbers down. Now, some of you have heard me talk about the R0 number. That is, for a simple person like me, let me just tell you about Mississippi. Mississippi right now is tied for the third best R0 number in the country. It's at 0.9. More or less what that means, and Dr. Byers and his many, many degrees could probably spend hours explaining this, but basically what it means is that if every person gives the virus at this point to about 0.9 people. When that number is over 1, that means that the virus is increasing in numbers. And the interesting thing about it is, even if it's 1.1 or 1.15, the exponential growth in new cases is significant, because if every one person gives it to 1.15, and then that 1.15 persons give it to 1.15, it grows exponentially. Mississippi today, and again, this is a number that I monitor very, very closely, is at 0.9. There are only 2 other states, Rhode Island and Arizona, who have numbers that are below ours. And so we're at a unique position in which, if we will work extremely hard over the next 10 days, we can really drive our daily case numbers down. Really drive them down. I would like nothing more than to be here in a week and a half to 2 weeks and say that our daily cases are below 500 per. That would drive us down from our current number of 5,037 that we had last week, down below 3,500 total cases. That's a goal that is possible, but it is only possible if we are exceptionally aware going into Labor Day weekend. The next 10 days are critical for us to really shoot these numbers down. And the reality is, as we've seen in our schools, we're having cases, but a lot more cases we found from kids bringing it into our schools because they had gotten it in the community. And so if you get the total numbers down, community spread is significantly less, and then there are less kids getting it and actually bringing it into the schools. So the next 10 days is critical, and that's the reason we have extended the order, and that's the reason we are urging everyone to really be aware of your surroundings and really be aware of making sure that we're working together to not spread the virus. Because if we can keep this R0 number at 0.9, continue to drive it down, we can really see significant progress. With that, I'm going to turn it over to Director Michelle. He spent some time with me over the weekend down on the Gulf Coast. As you can imagine, it's a very emotional time for our friends and neighbors on the Gulf Coast. And so, Director Michelle, give us your perspective today, please.
Thank you, Governor. Appreciate it. 2 things I want to update everyone on today. Obviously, give you a tropical update, and then a quick update on the COVID Mississippi Emergency Relief Fund. First of all, if you're looking out there on a wide screen like we are at MEMA, it looks somewhat like an air traffic controller's screen with the number of systems that we're watching. Most of you are probably aware of the 2, but we're actually looking at 5 systems out there right now. The latter 3 currently do not pose a threat, but it's too early to tell on those. We're watching Invest 2, Invest 1. Neither of those storms right now seem to pose a threat for us. Certainly, Invest 2, which is 135 miles southeast of the coast of North Carolina, is expected to move off into the east out into the Atlantic. Invest 1, which is not expected to pose a threat to us, I want to remind everyone that is similar track that Hurricane Marco took. until it made that abrupt turn just to the north through the strait there off at Mexico. So things could change, but again, the conditions are not expected to do so. I just want to remind everybody we're not quite halfway through hurricane season. We've still got a long way to go. Please remain vigilant and pay attention and respond accordingly, and hopefully we'll get through the Labor Day weekend without any issues. We do have a round of severe weather coming in this evening. We're looking at over the next couple of days, so just pay attention to your warnings. Pretty much off and on. It's going to be pretty much central to the northern part of the state is where the majority of that will be. So everyone just please pay attention there. With regard to Hurricane Laura, we still have a 27-person search and rescue team that is deployed to Louisiana that is assisting them. We have been on standby to assist them with additional resources as necessary. The National Guard did have 2 teams of heavy lift Chinook aviation aircraft to support not only Louisiana but Texas. Those assets have not yet been deployed, but they are available should they call upon that. Moving on to the Mississippi Emergency Relief Fund, we have approved a total of 94 applicants for that thus far. I do want to point out that only 39 of 82 counties have submitted applications there, so I just want to encourage everyone to get those applications in. October the 15th will be here very quickly. Of the projects, we have approved 4 county projects and 1 city project, totaling just over $2.6 million. We hope to be pushing that money out very quickly here within the next week, but we got a long way to go to utilize the $70 million. So if you are a eligible applicant for the Mississippi Emergency Relief Fund, to please get those applications in and your work projects to follow so that we can get you reimbursed. Governor, that's my update for the day, sir.
Thank you, Director Michelle, for your work and your efforts battling COVID-19. As we have said repeatedly, and I want to point this out, our goal throughout this entire process has not been to eliminate the spread of the virus, because we don't believe that's a realistic goal. Our goal has been to do everything we can to slow the spread such that we protect the integrity of our healthcare system. As I've told you for weeks, we peaked at about 1,250 total hospitalizations in Mississippi a little over a month ago. On Tuesday of last week, if you take both confirmed positives and suspected positive COVID patients, we had 920 patients in Mississippi hospitals. As of earlier today, we are showing 802. So we've gone from 1,250 down to about 920 last Tuesday, down to 802 today. We have 121 patients on ventilators and 207 in ICU beds. Just for perspective, at our peak, we had 339 patients in Mississippi in ICU beds with COVID-19. So we've gone from 339 down to 207. Again, we like to get that number down well below 200. Our total patients on ventilators between March, April, May, most of June were between 70 and 100. And so we're at 121 right now, so we need to, and we've seen a slight uptick in that, by the way, over the last 2 or 3 days. Nothing major, but a slight uptick. And so we want to continue to work on that, and that's what we're working towards. So with that, I'll open the floor to questions. Courtney Ann.
A twofold question here, and for both of you as it relates to colleges. First, in the kind of current world, you talked about Dr. Byers going last week to visit the campuses. Can you talk about what the quarantine and isolation looks like on those campuses, and if you feel like it's sufficient? You talked about it a little bit. And then forward thinking, if you guys are particularly concerned about those college students being in town over the Labor Day weekend. I know that we've been concerned about that age range previously.
Yeah, so one of the aspects that they're doing when a case is identified, and the ones that we went to are actually pretty efficient with not only once a case is identified, but quickly identifying those individuals who are potentially exposed. And it's just like in any other setting, those individuals who are less than 6 feet for 15 minutes or longer, and identifying those folks. And they have set up separate housing where they're moving individuals for quarantine, depending on the circumstances. Some of them, they're able to quarantine in place in their rooms, again, based on the circumstances, and getting those folks isolated as well who are cases, and getting them out and removing them from the shared space with the other cases. And, you know, one of the things that we want to look at is when cases are in a group, there's a potential for larger transmission. And so I think that they're acting pretty fast and being pretty aggressive with identifying those circumstances and getting those folks moved out. You know, the cases that are occurring on the campus setting, certainly they're going to have cases, and I think that they're jumping on them pretty quickly and doing all the right things to prevent further transmission on the campus. But it's those outside settings that are more difficult to control. Things like those get-togethers at an apartment, and honestly, I think, you know, over Labor Day, whether the kids stay at the college campus or whether they go home, I think the basic message is that we cannot get in big groups. Like the governor said, we've made some progress, and we really want to continue that progress. I'd really hate for us to be a week down the road and be talking about another big spike that we had like we did after July 4th.
Yeah, I think you look at what happened in the month of August. I mean, today's the last day of August, August 31, and we reopened virtually every school across the state. We did it with a number of different plans, K through 12. My kids are starting their 4th week of being in school. Some have been in school for 6 weeks, but most have been in school for 3 to 4. The college campuses, people have moved back, and obviously we were able to see during that time continued decline of cases and or at certain times a flattening off, so that we weren't growing really in any scenario. And so I think what that tells us is that we've got a chance now, having cut the total number of cases in half over the last 5 weeks, that if we, with an R0 that is down at 0.9, that if we can really, really pay attention for the next couple of weeks, the next 10 days, we have a real opportunity. And by the way, I hate that saying. I remember in March or April, I kept hearing people, primarily national folks in the press, say, "Well, just 2 more weeks, just 2 more weeks." And I don't want to be that guy. But I do think that if you are a numbers person and you just look at the numbers, we really are in a position as a state where we can see significant declines in total numbers, which again, as you get the numbers down in the community, it makes it a lot easier to ensure that we have school continuing throughout the fall. It makes it a lot easier to ensure that we have football games that we can attend, whether it's at the collegiate level or at the high school level. And so that's something that we've got to look at. Am I concerned about Labor Day? A little bit. I mean, I think you look at the initial spike that occurred after Memorial Day. There were a lot of things going on then, some of which was fatigue, some of which were the protests, some of which were get-togethers around Memorial Day. There was a lot of large gatherings, and so that's something that I am a little concerned about. I'm hopeful, given the number of people that have been affected, and now with total number of cases of almost 3% of the total population that are confirmed cases in our state. I believe that more and more Mississippians know somebody that's had COVID, and if you know someone that's had it, and certainly all of us do, even for those who were younger and healthy, it's a pretty tough, for most, week or two getting through it. It's just really challenging. Many of us know people who actually have passed away from COVID, and I'm hopeful that going into this Labor Day weekend, realizing where we are as a state and the chance that we have to really, really tap this down and keep our kids in school, keep our kids in college, get more and more of a normal fall will help us lead to that. Yes, sir.
Governor, so you're extending the statewide mask mandate for 2 weeks, is that right?
That's correct.
Can you tell us why you were photographed at the White House last week in a large crowd, not social distancing, with not wearing a mask, and yet you're telling Mississippians to keep wearing a mask?
Well, as I've said repeatedly, many of us throughout this pandemic, 6 months in, have not always worn a mask 100% of the time. I will tell you, at that particular event, the vast majority of time that I was there, I had on a mask. The vast majority of time I was in D.C., I had on a mask. The vast majority of the time that I was in North Carolina the week before, I had on a mask. I didn't do it 100% of the time, and as I look back on it, perhaps I should have done it more often. But I will tell you that there is no doubt when you look at what's going on in Mississippi right now, that it is pretty clear to even independent observers that the number of people that wear a mask, that stay socially distanced, that stay at least 6 feet apart from one another, that don't gather in large groups, clearly have had a significant impact during the month of August in driving down our numbers. And when you drive down the numbers in total transmission, what ultimately comes is lower hospitalizations, lower number of patients in ICU beds, and lower number of patients in ventilators, on ventilators. And so what I'm trying to submit to the people of this great state, that there is a path that we can take. It's not a perfect path, but it's also a path that I believe that beats the hell out of shutting down the state, beats the hell out of shutting down gyms, shutting down bars, shutting down small businesses, shutting down our economy. Wearing a mask and staying socially distanced and not doing what we've always done certainly is a nuisance. It's certainly not what any of us want to do, but it is a much better alternative than is to find ourselves where we were in late March and early April, when really people all across the country were shutting down their economy, and some of them have not even opened them back up. So, yes, sir.
Yes, Governor, on your, you said you modified the order for school football games. Just wanted to clarify, would that take away the other requirements for only two viewers per participant in the sport? And if so, you mentioned whenever you first issued that order that that was to help lower crowd sizes and like standing in line and things like that. Do you think that's going to be a problem?
Well, I think that what I will tell you is that over the last 2 weeks, during the duration of the 2 people per participant in the event, our schools, particularly our MAIS schools, because they were the primary ones that were playing, I believe have done a fantastic job of making sure that we have seen progress there. I think it probably gave them the opportunity to kind of have a trial run with even smaller crowds. But the challenge is when you look at the 25%, it gives a little more flexibility for the schools. It's still, in my opinion, the 25% capacity is one that we've had in place for outdoor venues for really months, for things like rodeos that have taken place. If the people, and particularly the school administrators in this instance, are very diligent in ensuring that 25% rule is followed, then we can have these crowds in such a way where they are not close together, where they are spread out, and where they can have very little contact with those not in their immediate family. And so, and let's think about this for a minute. And I think it's important that we always remember, so everything that we are doing now has a degree of risk, right? If you leave your home in 2020, there is risk associated with it. There is risk associated with the potential of contracting the virus, but we as Mississippians and we as Americans know that even before the China virus hit our country, there was risk associated with leaving our home anyway. There's risk associated with driving a vehicle. There's risk associated with the potential of having an automobile accident and something very bad and tragic occurring. That's the reason, for instance, that we have speed limit laws in our state and in our country. That is the reason that we have stoplights and stop signs, so as to try to minimize and mitigate the risk associated with doing certain activities, while at the same time giving people freedoms. And so that's certainly something we're going to continue to monitor. We are giving, we are pleased with the impacts of our of all of our people working together in August, and we're hopeful that we will continue to work together in September to continue to drive these numbers down.
Governor, if I can circle back just real quickly, there's a large group of Mississippians that applaud you for issuing the mask mandates and encourage to see you wearing the mask. There's another part of Mississippians, a large part, that say, okay, the governor isn't wearing masks in these large groups, something he's telling us not to do. I guess the question is, why are you being inconsistent in your messaging to the people of Mississippi? And then a quick follow-up, if you will.
Sure. I don't think I've been inconsistent at all. I have repeatedly encouraged Mississippians to wear a mask. We did not put a mask mandate in place until I believe it was sometime in early August. And the reason we didn't put that statewide mandate in place is because we believed that our goal is to get the most number of Mississippians wearing a mask that we possibly could, ensuring that they were social distancing. And what we've seen is that when we specifically named certain counties because they had met that threshold, which was of 200 or more cases from an absolute basis, or over 500 or more cases per 100,000 residents, that we actually got great participation from the individuals in those counties. And so my messaging to the people of our state is that I believe that there is a reason that we're seeing significant declines in transmission. I also believe that those reasons include that we do have a large number of Mississippians that are wearing a mask when they're in certain spaces. Look, when we look at the totality of the evidence at this point, there's no doubt that there's less transmission in outdoor venues than there appears to be in indoor venues. There is, when you look at our orders with respect to high school football and college football, for example, we certainly have said that individuals need to wear a mask when they are either congregating to get indoors or inside or outside the stadium where there are large lines. They certainly need to wear a mask when they are traveling from point A to point B. They need to wear a mask when they are going to the concession stands. But we've also said that if you're sitting in the stands around individuals that are within your own family unit, then obviously you have while we encourage you to wear a mask, it's not mandated. And so we think that we need to continue to do that for a couple of more weeks. And the one thing that you said earlier that I can absolutely agree with is every decision that I make, there's a group of Mississippians that really applaud it, and there's a big group of Mississippians that really don't like it. And I understand that, and I understand people's frustrations. But I'm going to continue to do as governor for as long as I serve the same thing I've done for the last nearly 17 years, and that is I'm just going to do what I think's right for the people of this state, and the politics will fall where it might.
And a really quick follow-up. Sure. Opportunity for you to respond. There's a movement, I guess, that's being led by one of your former rivals called Mask Off Mississippi, trying to encourage people to, I guess, disobey your order to not wear masks at all. Do you have a response to that and your message to that?
Yeah, I didn't know anything about that, and you know, the fact is that individuals are going to do what they're going to do. What I am suggesting, and I think what the vast majority of Mississippians agree with, is that we can wear a mask while in public, we can stay socially distanced, we can do those things. And by the way, I don't know that any Mississippian over the last couple of months has worn a mask 100% of the time. In fact, I feel fairly confident that most Mississippians have worn a mask most of the time, and it's having a huge impact. And, one of the problems with where we find ourselves as a country now is there are certain groups that want to politicize everything. We're in the middle of a pandemic, and what we're trying to do is try to encourage Mississippians to do the right things based upon data, based upon evidence, based upon the best advice that we get from our experts. And I will tell you, Dr. Dobbs and Dr. Byers and their entire teams have provided excellent advice throughout this entire process. We haven't always agreed. We don't always agree with exactly the right next course of action, but we sit down and we have conversations, and we do it in a respectful way. And I think that's what Mississippians expect in their leaders, and that's what we're going to continue to do. Yes, ma'am.
All right, we've got Jeff Pender.
Hey, Governor. I was wondering if you could provide maybe a quick update on the Back to Business Grant Program. And appears to have moved relatively slowly. Can you address what some of the issues with that might have been, and how you think things are moving at this point with that program?
Yeah, I don't have the specific numbers before me right now, Jeff, so I'll just talk in general terms. The Back to Business program that was initially put in place was somewhat constrained by the Treasury guidelines and somewhat constrained by the actual language that was passed by the legislature and state law. As you know, either last week or the week before, I can't remember exactly when it was, the legislature, led by Senator Harkins, had made some amendments that were recommended to them by the Mississippi Development Authority on ways in which to get that money out to the people. And my understanding is that that is a bill that has become law, and therefore I think we'll start seeing more progress and more success out of that particular program. Keep in mind that the vast majority of businesses, not the vast majority, but a large majority of businesses in Mississippi had participated in the Paycheck Protection Program, the PPP, that was passed by the United States Congress. And so that was done back in March and April, going into May. And so many of these small businesses had benefited from that. And so hopefully we'll continue to see improvements in the numbers for the Back to Business program. But I will get you the specifics and the exact numbers once we get done with this press conference.
Governor, just to clarify for folks at home about what's extended, so this includes the mask mandate, as you mentioned, but also the limits on social gatherings. Are you also extending, it may not have been a separate order, but I was thinking that it was with the college football guidelines. Is that a separate order, and if so, is it also extended?
We have extended that for 2 weeks until 2 weeks from today, which will be September the 13th, I believe it is, if I remember correctly. But we extended everything, and the only change that we made is whereas we had for athletic events associated with high schools and K through 12 institutions, whether MAIS or MHSAA, we increased, or at least changed, but in most instances increased the total number of allowed people in the facilities from 2 per participant to 25% of capacity. Again, that's something that was asked for by a lot of people, mainly just because it's hard at 2 per to make it work. And so that's still a good rule, by the way. It's a good way in which to do it. And I think you'll see a lot of schools continue that, particularly for indoor venues, because I will tell you, we've certainly had a lot of complaints, but we've also had a lot of school administrators that appreciated that 2 per, because it makes it very easy for them to administer, and so that they may stick with that. A lot of them probably will stick with that, but this gives some flexibility as well. Yes, sir.
Yeah, this is for Dr. Byers. In the past, we've talked about a possible second wave in the fall. Are you still concerned about a possible second wave, and when do you expect that Mississippi would be in the zone for that to happen?
Gosh, it's going to be hard to tell. Certainly, we anticipate that there's going to be some increases, and I think, but when that may occur, I think that we've seen some encouraging data recently with our hospitalizations, with our patients in the ICU, with the total number of cases we're seeing. We have seen our deaths down as well. I think things will be a little bit more complicated when we get into flu season, and I think that we may well see certainly some increases in the overall number of folks who are ill with respiratory viral illnesses like COVID or flu. Whether we see an increase or not, I think is going to be dependent upon a couple of things, and it's going to be dependent upon whether or not we still adhere to those things we've talked about the whole time. Going back to Labor Day, and I don't want to beat this, but I have to tell you, one of the things I'm worried about, and one of the things that we see repeatedly, is that when you introduce new people that you haven't been interacting with before, that's when you increase your chances of becoming infected. And so, when we get groups in where there's family members that are coming in town and you get together, that's where we see transmission. And if we start seeing that kind of behavior again, if we start seeing those kinds of activities again, I think that we will see some increases in our overall numbers. When that may occur, man, I hope it doesn't. I think, our schools are working hard to keep transmission down from occurring in the schools. I think our colleges are working hard to keep transmission down from occurring in there, but that doesn't alleviate the community transmission that's still out there. And I think all we are is just a moment away from us all forgetting and getting tired of doing the things that have gotten us this far. And if we all decide that it's going away and we don't have to do anymore and we don't need to wear masks anymore and we can socialize and interact as we have before, then I think we're going to see some increases. We're talking about temporary stuff. And if we can just get over the hump here, if we can get to a point where we start having an effective vaccine, and even if we're talking about 3 or 4, 6 more months, that's not long term. If we can just hang in there and keep doing what we're doing, I think we're going to see some continued leveling off.
Yes, sir.
Dr. Byers acknowledged earlier that we're at about 2,500 people who've died. Is that right? From COVID? Yet I hear very little acknowledgement of the lives that have been lost. Governor, do you know anyone do you personally know anyone who died from COVID-19?
I certainly know a number of people who have passed away as a result of COVID-19. Yes, I'm certainly not a medical examiner, but certainly those who had it that had other comorbidities. Yes, I know people that have passed away.
People that you personally know who passed away.
I know people who have personally passed away. I personally know people who have passed away during this COVID crisis. Yes.
Early on, there were a lot of discussions about outbreaks at places like funerals, weddings, those sort of things. Anecdotally, I'm still seeing photographs of relatively large gatherings, weddings, showers, things of that nature. Are we still seeing outbreaks originating from those type of events?
We are. Not to the extent that we were seeing before, but we still are getting cases associated with larger social groups like that. In a lot of cases, it's even with smaller groups, and all it takes is 1 or 2 people to let their guard down, and we can have some transmission that occurs within that group setting. And we still see that. We still see outbreaks in long-term care settings, and unfortunately, we've been seeing that since the very beginning. And I have to tell you, those folks in the long-term care facilities are working very hard. And the number of deaths that we've seen there has been particularly tragic. And going back to to the death thing, I have to tell you that, you know, we've seen lots of deaths in Mississippi. We've seen lots of deaths that have occurred in individuals who've had chronic underlying medical problems. We've seen deaths that occurred in older people, and certainly we know if we look at the data that individuals over the age of 65, that's where we're seeing the lion's share of our deaths. We still see deaths in younger folks. You know, we've seen deaths in younger folks. Unfortunately, you've had no other underlying chronic medical problems that would have put them at risk otherwise. So it's a serious infection. Most people shrug it off, especially the younger folks, but it can have some significant outcomes.
Yeah, I would just also point out because, you know, I get a lot of questions from individuals about what all, when I talk about data, what all numbers am I looking at? I would like to just point out that our viral lab test positivity rate from the information that we get from the White House actually fell below 10% for last week, which is the first time in a long time that has been the case. That actually takes us out of the red zone for that particular indicator. We know that testing demand in Mississippi is driven a lot by how good or how bad you feel, but that's certainly that test positivity rate below 10% is a positive development as well. So,
All right, Jackie, you can go ahead.
Hey, Governor, I've got a question about Tamika Drummer, a woman whose criminal cases received significant attention lately. Drummer was sentenced to life in prison in Mississippi for possessing less than 2 ounces of marijuana. Has been in prison for 12 years so far. An online petition calling for her to be pardoned has more than 36,000 signatures. Are you considering pardoning her?
I am not considering pardoning her at this time. I have heard of the case. I'm not familiar with all of the facts. I have seen someone say exactly what you just said, which is she has been in jail for 12 years because of having 2 ounces. I've heard that story. What I haven't been told is, because I understand that she was convicted under the habitual offender rule, I don't know what her other priors were, and so I don't know all the facts of the case, but I am not considering pardoning her or anyone else at this time, but we'll certainly look into it.
All right, Dave, you can go ahead.
Yeah, I have a question and then a quick follow-up, if I may. Governor, these restrictions placed on college football stadiums are pretty strict. USM kicks things off Thursday night in Hattiesburg. Southern Miss Athletic Director Jeremy McClain told me it'll be a challenge to enforce, and he strongly encouraged fans to do their part. He said people have to be personally responsible. Do you care to echo that sentiment and implore Mississippi college football fans to follow the rules?
No, I would love to do that. I want to encourage everyone to please follow the rules. As I have said repeatedly, the rules are not perfect. The fact is that the guidelines that we have put in place are not something that I wanted to do. But I've also said, and I'll say it again, I'd rather be in the South where we can't have tailgates and where we have rules in place, but we are going to have football, than to be in the Pac-12 where they're not even going to have football. But our ability to continue throughout the fall is going to be directly proportional with the individual fans' willingness to participate in making sure that these events do not become super spreader events. Because if they do, then I'm going to be put in a position, Dr. Dobbs and Dr. Byers are going to be put in a position where we have to reevaluate the decisions that I have made. And so, again, it is critically important that the people of our state that attend games wear a mask into the stadium, wear a mask when going to the going from one place to another place. They obviously can take their mask off according to the order when they're sitting in their seats, but we encourage you to wear it as much as you can, even while you're sitting in your seats. let's work together and let's watch college football, and let's have a great September and October, but let's drive down the numbers at the same time. Follow up, Dave?
I do. Thank you, Governor. Following the president's acceptance speech last Thursday night, people leaving the White House, including you and your wife, experienced some pretty harrowing sight, sounds, and situations on the streets of D.C. You took to Facebook. You were very clear on what you believed was menacing behavior by protesters. A lot of folks have played that down. What would you say then to them?
Well, no, anyone that has played down the ridiculous assault, in some cases, of individuals by the protesters have an agenda. There is no question that the way in which some of these protesters are acting is outrageous, it's ridiculous, and it, quite frankly, is beyond my ability to comprehend. I grew up in an America where it was okay to disagree with people. It was okay to not agree with them on politics. It was okay not to agree with them on college football. It was okay to not agree with them on certain things while still understanding that we were all created in God's image. And so, it is beyond my ability to comprehend why some of these protesters are acting the way they are. Now, I want to be clear, that was in Washington, D.C. In Mississippi, we've had lots and lots of protests, but they've all been peaceful, and it makes me proud to be a Mississippian that we can do things in such a way in which, in our state at least, when we want to protest, we do so in a peaceful way.
I'm sorry, Governor.
Go ahead.
Were you still, did I just get on the air there when I was talking to one of my coworkers?
I didn't hear what you said, but I did hear you talking. But we're all good.
Okay. I hope I let you finish.
Yeah, no, we're done.
Governor, you're not saying you were assaulted leaving the White House, were you?
I was not, no.
Sarah, you can go ahead.
Hey, this is a question for Dr. Byers, actually. Can you kind of go into the specifics about the process that the Department of Health uses when reviewing cause of death cases for COVID-19? Some that I know may show up today that might have happened a few weeks ago. And when you're doing that, are y'all cross-referencing any other mortality rate data, such as heart disease, cancer, or anything like that, that is typically reported under other circumstances?
So I'm pleased to tell you the process that we do, and certainly we've talked about this before, but we get deaths reported in a number of ways to the Department of Health, either from the facility where an individual was hospitalized, or in the case of a nursing home where they were living, often through the physicians themselves. And when we get those deaths, one of the things that we do is we look at the clinical presentation and the clinical spectrum to determine an illness consistent with COVID, as well as look for any lab confirmation. One of the things we also do is a review of death certificate data. One of the things that we use, and all states use this, is a case definition that is distributed by the Centers for Disease Control and Prevention that allows each state to count the same things, so that we're all counting things in similar fashion, so that when you compare the numbers of cases or deaths in one state, that you know that the next state over is counting the same thing. And so we apply the CSTE or CDC case definition to the vital records. And the case definition is basically if an individual has COVID-19 or SARS-CoV-2 listed as the primary cause of death or a contributing factor, then that is a COVID-related illness. Folks can have lots of underlying chronic medical problems. In some cases, they have other disease processes that also contribute to the death. But what we're looking at is COVID-related deaths. And so this is a pretty standard process that we look at when we look for any sort of communicable disease death that occurs in the state. Thank you for the question.
All right, Bobby, you can go ahead.
Can you hear me okay?
I can hear you.
Great. Governor, two things. You talked about politics a while ago, people politicizing things. If I may, in the most political of events at the White House last week, why were so many people sitting shoulder to shoulder, including yourself, not wearing masks? I just, what does that say about politicizing things when people look at you as an example? And second, if you could just clarify on the extension of the order, a refresher on how it relates to outdoor events and indoor events, in general. If you could do that, I'd appreciate it.
Yeah, sure. Well, I appreciate that. And I'll try to answer both of those questions. Generally speaking, with respect to indoor and outdoor events, it is certainly encouraged by me that we minimize the amount of gatherings that we have in large gatherings, particularly amongst those individuals that, as Dr. Byers said earlier, that you do not normally come in contact with. And so those individuals that are in your own household, it is likely that if one of them have had the virus, that you have had the virus. And so we certainly want to limit those gatherings to the extent possible. When you think about the risk associated with this virus, some of the things that are relatively clear are that there is less risk of transmission when you are outdoors than when you are indoors. That's why we talked a lot about communal living early on. Look, when you look at the individuals that were at the White House supporting the nomination for the Republican Party for President Trump, there's a couple of things that again, I don't want to spend a lot of time talking about it, but I do think it's important to note that there were 366 people invited that had been at the Republican National Convention, myself included, and in the 4 days prior, within the 4 days prior to that event occurring in Washington, D.C., every single one of us had been tested at least once, and most of us twice. Even with that, some of us, myself included, wore a mask for much of the event. Certainly not for the entire event in my case, but for much of the event. And so everything that we do today during the COVID-19 is a scenario in which we have to evaluate the risk and the reward. And I certainly believed, as did a number of my fellow Republican governors around the country, that this election is important enough and that our relationship with the president, we wanted to be there to support him. We wanted to be there, obviously, to show our support, and that is a decision that we made.
All right, Emily, you can go ahead.
Governor, I have a question about the unemployment benefits. Do you know what percentage of Mississippi residents who are receiving unemployment benefits are getting less than $100 per week?
I don't have that number in front of me, Emily. I'll go back and reach out to Jackie and get that number for you. When you look at the extension that the president provided, and by the way, I appreciate the president stepping up because the Congress did not act, although they should have. And I'm not sure they're going to act. I saw over the weekend where the Speaker of the United States House said that if and when the Republicans agreed to $2.2 trillion, she would then agree to discuss what may be in it. That's a position that I think is inexplicable and one that certainly hurts Mississippians. But I'll get you the number of Mississippians that are earning less than $100, but I do not have that specifically in front of me.
All right, Emily, you can go ahead.
Governor, I have a question about the unemployment benefits. Do you know what percentage of Mississippi residents who are receiving unemployment benefits are getting less than $100 per week?
I don't have that specifically in front of me. Well, it looks like we made it to 3:30, and I appreciate all of you being here. Appreciate what y'all are doing to help get the word out to the people of our state. What we are doing in Mississippi is working. Our numbers are coming down, our hospitalizations are coming down, our total cases are coming down. But now we got a decision to make. What are we going to do for the next 2 weeks? Are we going to continue to fight the fight? Are we going to continue to drive numbers down? Or are we going to do maybe what we did in June and early July and forget how important it is that we make good decisions? So I want to encourage everyone to continue to be smart, continue to wear a mask, continue to stay safe, and if we will, we'll make a real dent the next few weeks. So thank y'all, and God bless.